Dr. Genevieve Barnaby, consultant to Ayadike on home health care services, has revealed the importance of the scheme in this exclusive interview with Crushville TV.
The home health service is a short-term version of hospitalization. It's replacing the acute care. It's for the homebound, people that are finding it very difficult to get to the hospital, the vulnerable, the disabled, for children, and also for the pregnant women. It's also for the people that are in the rural areas that cannot access the hospitals. So home health would be a vast help for them. What we do is, initially, we have the primary doctor go into the home and do an assessment. After the assessment is done, then we now have what we call nursing care, where the nurse will go into the house, into the homes, to see the patient. Now the doctor would decide if they're going to go daily or if it's bi-weekly or 3 times a week. And then we're also going to send a physical therapist, we're going to send the occupational therapist, as well as the speech therapist. We're also going to have what we call home health aid, which is what you would call a glorified housekeeper that's able to do things like CPR and first aid. So those are the things we're going to put in place. Also, we'll have the dietitians and nutritionists going in there for the diabetic patients. I started working with Medicare in the United States 1994. I was actually the first person to set up, black person to set up home health services in Houston, Texas in 1994, and I've been doing home health since then. I'm also a doctor of chiropractic. That's taking care of adjustment of the spine and alignment of joints. That's what I specialize in. But as for home health, I've been doing it since 94. So I do have the experience here. We also have another sector of the home health, which we call assisted living, where we would create accommodation as an area where we could meet them and provide medical services for those that need it. Ones that are on the street, we would create facilities where we could gather them and take them there, provide medical services. It's a home health service. They are homeless, they don't have a place to stay, but we're not able at this time to create shelter for them. I've been doing it for many years, and I know it works, and I know it helps. You know, there are people that are at home, the paraplegics, the quadriplegics, bedbound. Some of them don't even have family members. They don't have loved ones to come and take care of them. Do you know what it means to look forward to someone to come into the house and take care of you? And the thing also about home health care is, apart from the fact that you're going into the hospital and having a medical service, this one is better because we are now able to assess the environment where this patient lives, to know what else we can do for this client. We're able to tell if they have family members that can take care of them. We can tell if the environment is safe or not. Those are all the aspects of home health that's very exciting that you would not get if you went into the hospital. Because the doctor doesn't have time to know. All he's going to do is take care of you, discharge you, and you go home. And you're probably going to go home all by yourself alone. But when you have the visiting nurses coming in, it's like having family. It develops a relationship, a personal relationship. But as for the hospital, if you're there and you're in the hospital, you can have 10 patients to one nurse. And they don't really have that time to spend with you. But in the home, you have at least an hour a day to have a talk, a personal talk with your nurse. It's going to reduce cost, especially not only for the government, but also for the individuals. This is a dream come true. It's not going to fail. Seriously, it's not. It's not failed anywhere else. It's not failed in North America. It's the #1 money-making business, Medicare, for the United States. Why would it fail here? Key into it and get this insurance and start taking care of yourself.
Achbong Jeremiah, Crushville TV.